Hello, everyone, and welcome to the Anti-Doping Podcast, brought to you by the Partnership for Clean Competition. I'm your host, Dr. Marie McNeely, and today we are joined by our guest, Dr. John Hertig. Listeners, John is founder of Hertig Healthcare Advising and former faculty in the Pharmacy Practice Department in the Butler University College of Pharmacy and Health Sciences. He's also past president and current board of directors member of the Alliance for Safe Online Pharmacies, and he's a member of the United States Food and Drug Administration Drug Safety and Risk Management Advisory Committee. And today we are excited to talk to John more about his career, his work, and the online pharmacies that have become a major problem in the anti-doping space. So, John, welcome to our show today. How are you?
Oh, thank you so much. I'm doing really well. Happy to be here.
Well, we are so excited to have you with us and to learn from your expertise and experience. But perhaps we could share with listeners a little bit of your backstory here first. So how did you initially get interested, John, in working in these areas of pharmacy, patient safety, and risk management?
Well, thank you for that opening question. And I think like so many of us, we find ourselves in these positions rather than seeking them out. And this is really one of those cases where I actually started as an engineer in college and got in about a year and realized this was not for me. And so I was on a hunt for something a little different. I very fortuitously ended up talking to a gentleman who recruited me to pharmacy, and I fell in love with it instantaneously. And it's been just a wonderful career to have as a licensed pharmacist. And then for patient safety, it again happened by happenstance. One of my first roles was at Duke University Hospital in North Carolina. And at that time, there were some significant patient safety events. And given the position I was in and leadership, I got pulled into those and just realized that harm is unacceptable. We should never be harming our patients in the course of therapy. And I was really committed and passionate about making sure we don't harm our patients and that we manage those risks that are necessary to ensure that our patients are getting both safe and effective care.
Absolutely. And I think everyone's career path looks a little different, particularly in the anti-doping space. So I love getting a sense of how you got to where you are today. So can you walk us through the steps of your career path, John, and tell us more about your current roles today?
It's really a winding road. I did find myself in a leadership role at Duke University Hospital, but then fairly quickly got recruited back to my alma mater, which is Purdue University in Indiana. And I was asked to help run a think tank. And that think tank was really focused on medication safety. How do we distill evidence and translate that to practice? How do we discover new ways to keep patients safe in terms of research? How do we partner with key stakeholders, not only within Indiana or the United States, but really truly globally? And so did quite a bit of international business development, which took me to 6 continents around the world, got to meet incredible people, learn how healthcare is provided in different ways and really learning from each other. And that's translated into my roles following my leadership role at Purdue University, where I then was recruited to Butler University as a tenure track faculty member, was tenured in that role, again, continued my research program, did quite a bit of work with the Alliance for Safe Online Pharmacies, with the International Pharmaceutical Federation, with the US FDA, and many other stakeholders. And once you find something you're passionate about, you just really run with it. And that's exactly what I did until earlier this year, where I was looking for a new adventure, kind of looking at what does the next phase of my career look like, and took a risk to go start my own firm, which is Hertig Healthcare Advising. Fortunately, in that role as founder, I'm able to continue a lot of my patient safety work, a lot of my international work, a lot of my contacts, and I get to work with fantastic organizations like the U.S. Anti-Doping Agency. So it's been a real true joy, and I'm fortunate to be in the position I'm in.
Definitely. And I know starting your own business is no small task in and of itself, but you have a variety of other roles as well. We only mentioned a few of them in the introduction. Can you talk about some of these other things you do and maybe how you balance all of these different roles?
Oh, well, I don't know if I'm balancing. I think that's an assumption. But yes, I do have some really exciting roles. I serve as a member, a board of directors for the Alliance for Safe Online Pharmacies. And that's a real wonderful group that is made up with industry partners, not-for-profits, regulators, professional societies, all looking at trying to figure out how do we keep patients safe as they're using the internet to access medicines. And I know we'll get into more of that here in the next few questions. But in addition to that, I also do serve on that US FDA Drug Safety and Management Advisory Committee, where new drug products or those being reviewed by the US FDA come before us and we comment on the safety, which is really fascinating and been really incredible to see what new therapies are on the horizon. I do quite a bit of work, like I said, internationally with the International Pharmaceutical Federation. I'm on the executive committee for our hospital practice executive board. And then I'm also on the board of pharmaceutical practice. And so we're looking at how is pharmacy services being provided globally. And that's, again, really fascinating. And you're able to learn from those that are doing the same thing, but maybe in a little bit of a different way. I also do quite a bit of research in two major thematic research themes. One is drug compounding. The other is in substandard, false counterfeit medicines. And then I'm giving talks a lot and keeping me on the road. It's a lot of fun. I'm really excited to be the keynote speaker at the Canadian Society of Hospital Pharmacy, which is going to be up in Ottawa next week. So never a dull moment. And I kind of like it that way.
Oh, that's awesome. And I think anti-doping is this field that relies on a wide variety of different specialties and people with different expertise. So for you, how did you discover that the work that you were doing was actually relevant to the field of anti-doping?
It was by happenstance. And actually, it discovered me, where there were individuals who were doing work in this anti-doping space, and they had come across my research in this space and my talks that I've given in a variety of different settings. And those individuals said, hey, have you ever thought about anti-doping? And until that moment, I really hadn't. But then as soon as we started talking about these intersections, it clicked. And there are so many aligned activities between what's going on at the U.S. Anti-Doping Agency, my work, others who are in the space, because keeping athletes safe and making sure that they have the information to keep themselves safe is absolutely vital, not only to their just general healthcare, but also the fairness of sport.
Absolutely. And perhaps we could dive into some of the details of just the pharmacy landscape. I think there have been some definite changes over the years. So can you talk about some of the major changes that you've seen and how you see this impacting athletes?
Pharmacy, like any profession, just continues to evolve, where you go back 200 years and it was all independents working in their own shop, mixing up remedies, and everything was really at that local level. And there are still wonderful independent pharmacies out there, but we have really shifted into chain pharmacy, massive manufacturers, a really complicated supply chain that relies on global collaboration. So pharmacy, like any other profession, is continuing to evolve and get complicated. I think in recent years, where we've seen so much shift is the role that the internet has played in accessing really anything. But if you think about specifically medicines and medical products, we now have an ecosystem where if I'm a patient or I want something, I wake up one morning and I can Google it and have it delivered same day in many cases. And not only are we getting a lot of our medical information on the internet, unfortunately, some of that might not be true. Like anything else, there's misinformation in healthcare. But if that information is more widely available, there's a lot more self-diagnosis, right? So me as a patient, I go see information. I'm like, oh, I think I have an infection. I'm going to Google what treats an infection. I'm going to buy that online. And again, they can have that shipped to you immediately. So that access using the internet has been a huge change for our pharmacy landscape. And access is good, but remember, it has to be access to safe and effective therapies. Just access to garbage doesn't help anyone and actually can harm you and even kill you in some circumstances, unfortunately.
Absolutely. And I think beyond even this shift for self-treatment, there's also maybe this self-care angle where things are not necessarily a drug you're taking for a particular condition, but just sort of overall health focus. Can you comment on this as well?
Oh, absolutely. It isn't just treating an acute condition. It's everything. It's prevention. It's supplements, and supplements are a huge part of healthcare and treatment. And you can find a lot of those online as well. So yeah, some of that self-care is significant. And unfortunately, when it comes to supplements, they're even less regulated than some of our legend drugs or prescription drugs. There's always someone that says something works, right? But being able to prove that it's both safe and effective is really the challenge. And unfortunately, some seemingly harmless product online can harm you. And there are lots and lots of examples of people getting harmed with products that were bought and sold online.
Definitely. So perhaps we'll talk about the traditional method that we've been using for years before this increase in internet behavior where people are purchasing online. What kind of safeguards are maybe built into this traditional model of care that consumers may miss out on if instead of going to their CVS down the street, they are going straight to an online pharmacy?
Absolutely. Well, in the traditional medication use process, you have some sort of prescriber. Traditionally, that would be a physician, but nurse practitioner, physician's assistant, anyone with prescriptive authority would do some sort of diagnosis and assessment. And then based on your medical need, perhaps write a prescription. So there's that first major step. And then that prescription might go to your local pharmacist who's reviewing that prescription for accuracy, making sure that they're only using products that are FDA approved, safe and effective. So they're dispensing those, making sure they're correct, making sure they don't have any interactions with perhaps something else you're taking or some side effects that you need to know about. And then they're dispensing that to a patient or giving that to a patient, all the while knowing that that whole medication use process is also under the authority of a regulator. In the United States, that's the US FDA. In Canada, that's Health Canada. And you know, because those products are regulated, that there have been quality controls, that you know that the active pharmaceutical ingredient is sourced correctly. So you have all these different, and I've only touched on the tip of the iceberg here. There are all these different steps involved by going on the internet. Unfortunately, so many of our consumers, our patients, and even our athletes are bypassing each one of those check steps because what they're doing, perhaps unknowingly, is self-diagnosing, saying, oh, I already done this before. I know what I have. I have a sinus infection, or it's just a headache, or I just have a little anxiety, whatever it is. I'm going to self-diagnose, and then I'm going to just Google it. I'm going to then buy that product online. And unfortunately, right there on the open web, we're not even talking about the dark web or the gray web, but right there on the open web on Google, that first page, over half of the search results that are returned are likely illegal pharmacies selling illegally to the United States. And by doing so, you're then bypassing all those safeguards. And that is what can get you into trouble. Best case scenario, you're getting something that works. But unfortunately, all too often, you're either going to get something that doesn't work, or worse, get a product that even isn't what it says it is. And it might contain different products or different medicines that can harm you or exacerbate your health worse, or even show up on a test, right? If you're an athlete in the anti-doping space.
Definitely. It sounds like there are some major risks involved, but what does the research say about why are more people turning to these online pharmacies to purchase medications rather than going through this traditional model that has all of these different safeguards?
Comes down to three factors, and we've been researching these factors for many, many years. It's cost, it's convenience, and it's access. And if you look at cost, that's pretty obvious, is people believe, right or wrong, that you can shop for a better price and get a deal online. So there's this cost component. But then there's these other two, which are really growing in terms of percentage of why patients or consumers go online. Convenience, we know that, is you can sit in your pajamas and you can order anything from toilet paper to Oreos same day to your door. Well, medicine's in the same bucket, and particularly because of the pandemic, when so many of us were restricted, say, to our homes or to a location and weren't able to get out or get out safely, we really learned to use the internet to get all these things that maybe we wouldn't have in the past. And that has stuck post-pandemic because of that convenience factor. It's incredibly convenient to use the internet. The last one, access. Now that is really interesting because access takes many forms. It could be geographic access. There are many pharmacy or healthcare deserts in this country, meaning that people can't actually go to a pharmacy because it's too far and maybe they don't have reliable transportation or can't make it there. And so that access via the internet is and can be a lifesaver if used correctly. We also have stigma. And so there's access bias and access barriers because of stigma. Say you have HIV or you have another sexually transmitted disease and you don't want to go to a sexual health clinic because of the stigma. You may just want to go online and be anonymous. We have access because of either social economic issues where people can't afford it. So access is actually growing as a main driver, but it is those cost, convenience, and access drivers that lead people to go online to buy medicine or get medical information.
Absolutely. And I think there's an awareness component as well in terms of the ads people are seeing, whether it's on social media or websites, just this knowing that this option is out there.
It's true. And it's interesting. You mentioned ads. The United States is only one of 2 countries in the world, I believe, that actually offers or allows direct-to-consumer advertising of prescription drug products. New Zealand, I believe, is the other country. Interesting fun fact for your dinner conversations. But yeah, the more awareness, particularly around popular medications, the more people are going to go try to figure out how to get them. So this has been everything from old weight loss medications like fen, which were proved to be incredibly dangerous, to sexual health, erectile dysfunction drugs like Viagra and Cialis, which were and continue to be counterfeited all the time, to now the most recent really popular medications, which are the GLP-1s, those injectable medications that have done wonders for both diabetes and weight loss. But anything that's incredibly popular or in demand is going to be counterfeit and is going to be put out there on the internet for sale, regardless of how safe or unsafe it might be.
Definitely. And I think in our conversation so far, you've highlighted some examples, but what are some of the common issues that you see with online pharmacies that are actually making them quote unquote illegal online pharmacies?
There are so many ways that a pharmacy and an online pharmacy can be deemed illegal. Some simple ones, they don't require a prescription. Well, if you're prescription only medicine, that means you need a prescription. So if you're not requiring a prescription to dispense it, that's illegal. It could be that you're not dispensing medicines that are regulated correctly. And what I mean by that is, say I'm a Canadian pharmacy. If I want to sell medicines into the United States, I need to be both licensed in Canada and licensed in the United States to where I'm shipping to, whatever state that might be. If I'm not licensed in both, that's illegal. Or say I'm not selling US FDA approved medicines to US consumers, that would be illegal, because to get medicine in the United States, it has to be cleared by our regulator, which is the US FDA. So there's a lot of these different ways that things can be illegal, but to the point where it carries great risk is this idea that a lot of these online drug sellers that are illegal are selling what we would call substandard or falsified, otherwise known as counterfeit drugs. And that's where the real danger is. And the estimates from the World Health Organization are there's anywhere between 10 and 50% of those illegal online pharmacies are selling that SF counterfeit medicine. And that's where we have things like fillers for the medicine that don't belong there, like road paint, chalk, brick dust. It may have medicines you didn't ask for, so just random other medicines. Now, some of those can be somewhat benign, but you didn't ask for it, you don't want it. And unfortunately, a lot of them are really dangerous. And that's when we hear about this fentanyl, for example, where I was just wanting a pain med because my back hurt, or I just wanted a Xanax, alprazolam, because I'm a little anxious. And they get it online, and this is particularly in our younger population, where they'll buy it on Snapchat or Instagram or whatever it is. They'll get that one tablet, and unfortunately, they don't know that that tablet has fentanyl in it, and they never wake up. And I've talked to a number of different parents who have lost kids where they just had a test. We're taking, unfortunately, say an ADHD medication to help focus. That ADHD medication was laced, and that kid never woke up. And it's a tragedy. And that's why we're so concerned about these websites, is that so many of them are selling bad products to unknowing consumers.
Certainly. And I think this is a perfect segue to my next question, which is talking about what are some of the risks for consumers. Obviously, as you mentioned, death is a huge and tragic consequence that can happen if you take these drugs that may not be made properly or regulated properly, and you don't necessarily know what's in them. But John, can you elaborate on this more and perhaps comment on the risks specifically for athletes who may be purchasing products from online pharmacies?
Yeah, and we know our consumers, they are patients. So the risks to them are the same as to you and me. But in addition, we have these risks of the drugs containing banned substances that they didn't know about. I know athletes are very knowledgeable about, okay, what can and can't I do to make sure that I'm managing the banned substance rules? So they may be buying something online that they know is fine, but unfortunately it contains some of these banned substances. And so not only are they putting their health at risk, they're putting their ability to compete at risk, which is another added layer of risk for these incredible athletes.
Absolutely. And I think one thing that we haven't touched on yet is the dosage or drug interactions, thinking back about some of those safeguards that are in place in a traditional pharmacy setup. Can you comment on how that's impacted in this online pharmacy world?
Well, there are some online pharmacies that are legitimate, that are great, that provide access to needed patients, that provide products. And they're operating just like any other pharmacy, where they do have the double checks. They do have the quality control process. Their pharmacists are acting in good faith. Unfortunately, if you look at the complete denominator, the total ecosystem of online pharmacies, we, not me, but the National Association of Boards of Pharmacy, who does a lot of work in this space, estimates that about 95% of that denominator are illegal, that are bad actors. that means only 5% are legitimate. And so there is a huge denominator and a huge opportunity. We're probably looking at 25,000 plus or minus illegal online pharmacies. So it's a huge risk for patients who might not otherwise know that what they're doing is unsafe. And that's where education comes in and is so important, not only for our general consumers, but particularly for, again, athletes who may be getting substances that they just don't know about. And when you have substances that you don't know about, it also can contain products that interact with others that you didn't know about. And so not only are you not getting the benefit of having a physician or a pharmacist review, but in addition to that, you might be getting products that do interact unknowingly with products you're already taking. So again, a very risky proposition to go online without good education.
Absolutely. And I think this education component is key and really important to raise awareness. So what are some of the misconceptions that people might have about just going online, buying medications that you really want people to know are incorrect?
Well, one is please talk to your doctor, talk to your pharmacist. I am a pharmacist, so I'm going to be a little biased here, but pharmacists are the medication experts. We're very accessible. Just talk to us. We want to help you. Don't just go it alone. Make sure that you're leaning on your health professionals. But other risky misconceptions are, one, I think there's a large proportion of the US population that believes that if it's online, it's been reviewed by somebody. And maybe it's your state board, maybe it's the federal government, but that is completely untrue. There's no formal review of those pharmacies that are online selling products. So don't just trust blindly. That's a really risky proposition. The other misconception is that every product that's sold online is safe. And that is absolutely not true. So not only are we not reviewing them, but we know for a fact that there's a large proportion of those online pharmacies that are selling products that are not safe at all. And just because it's online and it looks official doesn't mean it is. So be a healthy skeptic, I think, here, and making sure that you're double checking and that you're using resources to make sure that you're buying a safe product.
Absolutely. Were there any things that you've, learned as you've gone through your education and your career that surprised you about how all of this works?
I'm surprised all the time just to see how complicated our supply chain is. And I think that many of us might be a little bit more aware of that just because of the political environment we're in, where there's a lot of talk about taxes and tariffs and supply chain and shortages. And our supply chain around medicines is just as complex. And it does take advantage of global producers, global warehousers, global partners and stakeholders. And so because it's such a complicated global supply chain, criminals can take advantage of that fairly easily. And that's the other thing that really surprises me is how smart criminals are in terms of targeting people, whether it's through marketing or ads or direct to social media feeds. Criminals are incredibly adept at marketing. The other thing criminals do really well, unfortunately, is logistics. And so I could be a patient in Indianapolis. I Google something. It looks like a Canadian pharmacy. It's not a Canadian pharmacy. It's hosted in Brazil or China. My credit card information is processed through a bank in Azerbaijan. It's filled in with an India generic product that might or might not be real, might be counterfeit. It's then shipped to Canada, repackaged with a maple leaf, and then sent in the mail to me to Indianapolis within 2 days. And I have no idea that my information went all those different places, that it wasn't processed through a major bank, that it wasn't filled with something from Canada. It's so shocking to see how these criminals take advantage of a very lucrative business. I mean, these criminals are making millions a month through doing this. And actually, I believe, based on most recent data I saw, that the criminals engaged in drug counterfeiting and online sales has surpassed gun running, human trafficking. It is really, really big business. And so it continues to surprise me as I work with law enforcement and others who do more work in that side of it, whereas I'm a little focused on the healthcare side, the patient safety side, and the consumer side.
Definitely. So this is a huge global problem. We hinted a little bit about doctors and pharmacists, things that they might be able to do, but also thinking about coaches or others that athletes interact with. How can they help people make better choices for sourcing medications and just being safe in this difficult landscape out there?
Well, I've made this so much of my life's work now. I mean, it starts with education. It can't end with education, but it really does start with education. When I first went around and did this work and did research in this area, I would essentially just go around and scare people. I'd just be like, okay, this is really scary. It's really bad. It's going to kill you. Okay, have a nice day. So we've moved past that, right? I think the awareness is important, but now it's what are the tools that we can use? So the awareness is key. Just knowing that this is a problem on the internet will, again, help you hopefully be a healthy skeptic. When I did research many years ago, I asked nurses, physicians, and pharmacists, do you talk about this issue with your patients? And regardless of those big three health providers, I think about 70% didn't mention this at all. It wasn't ever discussed. And then if you did discuss it, about half the time, so 15% of pharmacists would say, yeah, it's great. Go ahead and do it. Go online. The other 15% said, wait a second, let's have a more detailed conversation. So only really 15% even engaged in dialogue. That's got to be much, much better. And whether it's a health professional or a coach, just making people aware of this issue and that it can be dangerous is key. But then it's about moving to some of the tools. And we do have some good tools available. One is Safe.Pharmacy. So if you go to Safe.Pharmacy, you can actually type in the web address of the website that you're looking to purchase from, and it will tell you whether that website has been deemed legitimate or not. That's really easy. So it takes the guesswork out of it. That's Safe.Pharmacy, and that's run by NABP, the National Association of Boards of Pharmacy. But then again, maybe the most simple thing is talk to your pharmacist, talk to your physician, engage with them on this issue. Don't just guess and don't just assume that anything on that first page of your Google search result is just fundamentally or inherently safe.
Definitely. And you mentioned that the safe.pharmacy.com will help you determine whether the site you're looking at is legitimate. But I guess, do you know what criteria are used to determine whether something is legitimate? I know these online pharmacy sites can sort of pop up new ones all the time. And how do you know whether something is legitimate or not?
It can be really difficult. And we actually did another research survey more recently where we looked at licensed pharmacists. So we did a national survey of licensed pharmacists in the United States. And about half the time, those licensed pharmacists were able to identify an illegal pharmacy, but another half, they weren't. So it's essentially a coin flip. And that's for pharmacists. I mean, this is what we do, and it's a coin flip. So it can be really difficult to identify some of these illegal pharmacies. There are some giveaways if they're promoting blatantly certain medications. So if you go to the webpage and they're like, buy one GLP-1, get one free, or now 50% more Viagra, those are pretty strong giveaways. If they're looking at shipping worldwide, if it says on there, if it says that there's a currency calculator, I mean, these things shouldn't exist for pharmacies that are just operating in one jurisdiction. And if they're given deals and that kind of stuff, it can be pretty obvious. But the best thing to do would be to just check and verify that website and use Safe.Pharmacy as a way to do that. That's probably your best bet because NABP and other organizations have used a variety of different criteria, some obvious and some not, some more focused on web sleuthing. So they've done the hard work for us, and it just makes sense to use their website to verify.
Excellent. Well, we appreciate you sharing that resource. And I know we mentioned earlier that you are on the board of directors of the Alliance for Safe Online Pharmacies. And we talked a little bit about what the organization is, but could you go into a little bit more detail about what the organization does and how it's helping to make purchasing medications online safer for consumers out there?
I'd be happy to. I really appreciate the opportunity to talk more about ASOP. That's the Alliance for Safe Online Pharmacies, ASOP. Been around for many years and really provides a forum and structure for the interested stakeholders. We have industry members. We have the United States Pharmacopoeia. We have the National Associations of Boards of Pharmacy. There's patient advocacy groups. There are pharmacists. There are academics. And we're all in this together to try to figure out how to keep our patients, athletes, consumers safe when going online, because the internet can be great. It really can be. I mean, I know I talk a lot about the risks and dangers, but remember, there's 5% of those online pharmacies that are doing wonderful work and that are providing access and that are helping people who may not otherwise be able to access care. So it's important to know that there is a 5% of the online pharmacies that are doing wonderful work. But what the ASOP does is seek to do a few things. And when I talk about this issue globally, I talk about the supply side and the demand side of the issue. So the supply side is the actual online pharmacies themselves. And how do we make sure that we're trying to keep only those online pharmacies operating that are safe? And that's more like the law enforcement and the regulatory side. So how do we shut down the bad actors and provide regulation to keep the good actors good and then enforce that? That's all the supply side. That's not me. I get to meet all these really cool FBI agents and Interpol agents and FDA, Office of Criminal Investigations agents who are doing incredible work. That's all the supply side. Where I'm doing a lot of work and where ASOP does a lot of work is on the demand side. So how do we educate consumers? How do we help our consumers make good choices, like verifying before you buy, How do you make sure that our health professionals are engaging with our patients, with our consumers, with our athletes on these issues, actually having conversations? One of the key questions I've really tried to push my pharmacist colleagues to ask is, where do you get your medication? We typically don't ask that question. We say, what did the doctor tell you to take it for? Did they tell you about any side effects? We don't say, where do you get your medication? And if they say, oh, I get everything from you, that's great. Or, oh, I get some from you, but I get some from Costco or Walgreens or CVS across the street. Okay, that's fine too. If they say, oh, I just Google it and I go to the Canadian online pharmacy because it looks really nice, oh, okay, well, let's have a conversation about that. Is there a way that I can help you access your medication safer? Did you know about these risks? So it's really doing tons of education, but then acting on that education and making sure that people are more aware of the issue. And that's some great work that ASOP's been involved in addition to other advocacy work, state-based work. It's really been a rewarding organization to be a part of.
I think that's fantastic. And I think your response just highlights a lot of the individuals that are involved in this process of trying to make it safer for people to get access to the medications and the drugs that they need. So how do you collaborate with other stakeholders, whether it is law enforcement or in the case of anti-doping, national anti-doping organizations, researchers and funding organizations like the PCC in the work that you do every day, John?
It has to be collaboration. This is a huge issue, I think, as we've articulated and highlighted, and it's going to take a lot of different stakeholders and people doing a lot of different approaches to get traction and keep our healthcare as safe as possible. So I'm very open to collaboration. I've always been open to collaboration. One of the main avenues that we have available to us is ASOP, is the Alliance for Safe Online Pharmacies, because it's that forum to bring a lot of these individuals together, the law enforcement, researchers, funding organizations. It puts us all in the same room. So not only are we able to share victories and leverage those opportunities, but if there are needs, we're able to articulate that amongst that forum of ASOP. The other thing we do is I do a lot of talks on this issue, both nationally as well as internationally. I worked with the International Pharmaceutical Federation and the World Health Organization to develop a curriculum for health professionals on specifically online pharmacies. So not only are we doing these one-off trainings, but how do we then hardwire training on this issue, not only within the United States, but globally, since it's a global problem. And then I get to interact at conferences with these wonderful individuals as well, including one put on by the U.S. Anti-Doping Agency and PCC, where we got to share lessons learned and work with law enforcement and work with academics and make sure that we're all getting really smarter together. So lots of different opportunities here. There's another group out of Johns Hopkins that's doing some great work. So I love that I'm seeing so much more traction when it comes to these issues, much more in the past 5-10 years than I'd ever seen before.
Definitely. I think getting everybody talking about this is critical. And you mentioned conferences you recently attended and were a speaker at the PCC's conference earlier this year. So, John, can you share what was your experience like at the event, being able to just meet with people and share your work?
I really appreciated the opportunity to be there and the invitation, and I found it incredibly rewarding. I'm used to some of the reactions that I'll get from an audience, especially those that don't understand or haven't seen the true breadth and depth of the issue. And there's a lot of initial shock. But what I was really heartened to see is that after I gave my talk, both in person as well as through subsequent conversations, there's been so many individuals at PCC's conference that I've talked to, and they're like, how can I help? What can we do? Have you seen this? Have you seen this other sports conference? We would really like you to speak here. Just the activation and engagement that I've seen coming off of the PCC conference has been incredibly heartening. And clearly there's a need here, not only for athletes as patients, but athletes as athletes, to make sure that they're armed with information that they need to make really good decisions for their own healthcare and self-care. And I've had a few requests from individuals who work in that space in a variety of different sports asked for my slides so that they can educate, and that I'm happy to give those freely because, again, we all need to work together to ensure that our patients are kept safe when they're accessing healthcare.
Absolutely. I think you're 100% right when you say clearly there is a need. There are still a lot of problems in this area and a variety of other areas in anti-doping that everybody's working together to solve. So if we gave you all of the resources you could dream up, John, is there one particular problem in anti-doping that you would most want to solve?
If I had a magic wand, I would just wave it and make doping go away. I mean, so that athletes wouldn't have to go through these rigorous programs and that we wouldn't have to worry about this all at night, and that ultimately sport would be fair. Because I think that was a key takeaway that I got out of the PCC conference, is that athletes put in so much time, so much effort. There's so much sacrifice to it. And to not have a fair competitive landscape is a real crime, is a real injustice for these athletes that are doing the right thing. So if I could just make it all go away and just not have it be an issue and that people wouldn't do it at all, that would be one huge win for just sport and competitive fair play.
Definitely. And I think it's a complex issue. There are so many different factors that go into this decision in some cases to dope, or these cases where people are inadvertently exposed to doping agents. And I think this is just a difficult challenge that is requiring a wide variety of expertise. So we appreciate you contributing your knowledge to the problem and helping us solve some of these big issues. But John, if our listeners enjoyed our conversation today and they want to learn more about you and your work, or perhaps reach out, what is the best way for them to do so?
Well, thank you. I've really enjoyed our conversation. And if the listeners want to learn more about me in my work, I would direct them first to LinkedIn, and that's LinkedIn/John Hertig. But you can also visit my website. My firm's website is www.hertighealthcareadvising.com. And there you can find a link to my publications, many of which were referenced here today, but also some recent media appearances. And then my email is on there as well, and would be happy to connect with you.
Excellent. Well, John, thank you for sharing these resources with all of us. And listeners, definitely take some time to get connected and to read up on the great work that John and his colleagues have been doing. And John, it's been such a pleasure to chat with you today. We really appreciate you joining us on the show.
Likewise, I really appreciated the opportunity. This was fun.
It was wonderful to have you here. Listeners, always great to have you here with us as well. If you haven't already, please take a moment to rate our podcast, leave a review, and subscribe on your favorite platform. And listeners, please note that the Anti-Doping Podcast features a wide variety of clean sport experts, and episodes may include statements and/or viewpoints that do not necessarily reflect the views or values of the PCC. Thank you, and we look forward to seeing you on the next episode of the Anti-Doping Podcast.